at the age of 21, I got incredibly drunk in the evening celebrating my birthday, tried to mount a pavement on the bike, wasn't wearing a helmet at the time. The wheel went like this and I fell off bike at incredibly slow speed but smacked my head on the pavement. If you have a really sudden impact, whoosh, like this, what happens is your brain, these surface areas of your brain will touch the really sharp areas here and cause internal bruising, if you will. So you damage the internal part of your brain. Dr. Lowe presented to me that I had problems with pooling of my cerebral spinal fluid. It really, really shocked me. But the good news is I can do something about it. In this episode of my show, Brain Health, Unchaining Your Pain, I'm really excited to share with you the shocking results from my functional brain scan, which I had done at the Amen Clinics. And the reason I want to share this with you is because I think it's so important that we understand how our brain is functioning and therefore learn what we can do in order to ensure our brain is functioning better. So just a quick recap on my history. Back in 2016, there or thereabouts, I was hoping to go and join a different branch of the military, went and did an IQ test and a whole load of other assessments. I failed the IQ test. That was the first red flag, as I never had that done before. Over the course of that year, I fell pregnant. I'm really excited to become a mum. And sadly, I had a miscarriage very early into the pregnancy, only about 7 weeks, but it was really horrific. And shortly after that, I was told by the firm that I was working for, I had no emotional intelligence. Those were two big further red flags. That put me into a very rapid downhill spiral. I felt like an emotional failure. I felt like an intellectual failure. I felt like a biological failure. And I spiraled down super quick and started having suicidal thoughts. At that time, I thought, well, I need to go and get coaching support to help me through the workplace struggles I was having, because I was put on an unexpected performance review and I put all of my energy into focusing on that and none of my energy into focusing on my mental health and well-being. And the coaching that I had from a workplace perspective was great, but something was missing, and that missing piece was really looking at my brain health and helping me learn how to pull myself out and how I could optimize it. So I called in through high performance coaching. I got myself a professional coach, a high performance coach who was also an emotional intelligence coach. And therein starts my brain health journey. When I went to the States, I discovered the amazing work by Dr. Daniel Amen, and I was super fascinated by the work he's done on imaging the brain. And I really wanted to learn how I could better optimize my brain because I knew my brain was in trouble. So I set to work, first of all, reading the Change Your Brain, Change Your Life book. And then I started my training, become a brain health practitioner and trainer. And over the course of that training with the Amen Clinics, I realized that I'd really done quite a lot of damage to my brain over the course of my life. And I wanted to understand, had all of my antics as a child, falling off a bike when I was about 7 years old. I went head over heels over handlebars when a boy was chasing me. It was terrifying. I then had lots of different little accidents when I was a kid, falling off bikes. And then at the age of 21, I got incredibly drunk in the evening celebrating my birthday, tried to mount a pavement on the bike, wasn't wearing a helmet at the time. The wheel went like this and I fell off the bike at incredibly slow speed but smacked my head on the pavement and had a really sore head. I continued on in the night celebrating but was constantly throwing drink everywhere. Went to bed with a sore head, woke up in the morning, cycled to work. I was working in Germany at the time at a university. And when I got there, I saw all of the letters were swimming across the page. And I thought, that's not right. So I phoned my mum and she says, you've got concussion, you stupid idiot. Go to the hospital and get yourself checked out. So I did. I went to the hospital, got myself checked out. They told me that I had all of the muscles in my neck had gone super tense, that I had a C-spine injury. They x-rayed my skull. They couldn't see any damage to my skull. So they said, please just wear this neck brace for a week. And all will be well. I experienced head pain on the back of my head. I hit my head here on the back for about 2 or 3 years, and I can still feel that head pain now. And then later on in my life, I took up skiing, loved skiing, and had several skiing and boarding accidents, a massive boarding accident where I flipped horizontally and vertically with a colleague I was skiing with in the States, boarding with in the States, and sliced my knee open. But he had concussion, so I must have had concussion too. In addition to that, had some further ski incidents, fell over on really soft snow actually with a helmet on, and sustained some mild concussion, and again got put in a neck brace by the hospital, told to go home, and nothing ever more was thought of it until I read the book Change Your Brain, Change Your Life, and I realised my brain really could be in trouble. So as fast forward to 2017, I was going through my coaching journey, met the wonderful Dr. Daniel Amen, and decided I really wanted to be certified as a brain health professional. I really wanted to get my brain scan because a picture paints 1,000 words, and I'm very excited to share my scan with you today, and also the findings by Dr. Sandy Lowe, who is my psychiatrist at the Amen Clinics, who I work with and partner with my clients. And so when I first went to the Amen Clinics, I was breastfeeding because I was really lucky enough to fall pregnant again and have my daughter Lily, who's now age 6. And when I first went, I had a QEEG scan, which looks at your brainwave activity, principally on the surface of your brain. And it's really good for understanding whether you have any traumatic brain injury. That was the first sign that I knew something was in trouble. I was also noticing that I was experiencing cognitive recall issues of words, which I do today. And I wanted to make sure that I was doing everything I could to minimise cognitive decline. And I also wanted to make sure when I got my brain scan recently at the Amen Clinics using single photon emission computer tomography, which is called SPECT, which looks at the activity in your brain, that my brain was not going to decline anymore. And if it was declining, that there were simple steps that I can take to reverse cognitive decline, which I'm fully aware we can do, although many medical professionals do not let people know that it is possible that you can change your brain and you can change your life. So key things to know about your brain. Your brain is housed in a really hard skull. Your hard skull is often it's your own helmet to protect your brain, but it's not that good at protecting your brain in totality, because when we take the skull off, and this is your brain inside your skull are these really sharp bony ridges, which you can see here. So these are the ridges that are right behind your eye sockets. So your eyes are the actual only part of your brain that is outside your head. So when you have an accident, whether you fall off a bike or you fall over skiing or whatever that happens to be, your brain moves backwards and forwards inside your skull. And it is coated in cerebral spinal fluid. So the fluid acts to some extent to protect your brain from damage. But if you have a really sudden impact, push like this, what happens is your brain, these surface areas of your brain, will touch the really sharp areas here and cause internal bruising, if you will. So you damage the internal part of your brain. And it doesn't matter if you fall off a bike, you fall out of a tree, whatever, if you fall over playing rugby, it's the same effect. It's force per unit area. It's all about physics. When you have a high force and it hits a very sharp ridge inside your brain, you are going to cause internal brain damage, and that is the form of bruising. So you might get bruising and breaking of the brain cells inside, and that will start to cause some cognitive decline. The other thing that can happen is that when your brain moves, in the bottom of your skull, you have a hole, which is where your spinal cord comes out. So this is where your brain connects to your spinal cord. And this is also right deep in the centre there is where your pituitary gland is housed. Now, if you have a bump, whatever that may happen to be, like I did, you can displace the brain inside the skull, and that can affect the way that the brain is sitting. It can damage the pituitary gland inside your skull because you've displaced this spinal cord. And then what can also happen is, particularly for your neck, your brain and your skull, this bone sits on a very, very delicate structure. Your whole head sits on a very delicate structure called your atlas, which is the first. It's the C1. It's the first bone of your spine. And if you bop your head around, you can displace the seating of that of your skull on your spine, and it's very, very easy to do. I've even had a child age 7 who's having that happen, and that can cause cognitive issues, including migraines, including loss of limb function, all sorts of different challenges that are often missed by the medical professionals because they don't image the organ that they treat, and they also are not aware of the fact that any displacement of your bones that your skull sits on can impinge the flow of fluid into and out of your skull, and that impingement can cause these problems. And that was what I was really interested in learning about from my brain scan, to see if I had, from my multiple head traumas, or my multiple falls I'd had, skiing and cycling and so on, whether I'd actually displaced the bones in the back of my neck, and that was impinging on my cognitive function, and whether that was causing the symptoms that I was experiencing. And I know I can do something about that because I help other clients with that too. So I was super excited to learn about my brain. And so here I am going to show you some of the findings from my brain scan. So first of all, a bit about the brain scan that we have. I have at the Amen Clinics. So you'll have a surface image, so a surface scan, which Dr. Lowe talks about, and this is looking at the average activity across the surface of your brain. And this is really good at understanding whether you have any trauma to your brain, from bumps to the head or concussive blows, whether you have any toxic load in your brain, which can cause a ripple effect, or it looks like Swiss cheese if it's really bad on your brain, and whether you have any damage to your temporal lobes, which is this side of your brain, your prefrontal cortex, which is at the front, and then at the back of your brain, because what can happen when you have an accident is you get a contra coup effect. So when your brain flies forward when you bump it on the ground, it also then, because it's hit the front of your skull, it will then hit the back of your skull. So you can bang your head here, you can damage your brain this side, and then also that side, called a contra coup effect. So you can see that on the surface scans. What they do next is they then look at the depth scans of your brain, and you'll see Dr. Lowe talking through this. So they'll look at deep inside your brain. So they'll take slices, and they'll do a slice through the top of my head, a slice this way. They'll look at the underneath, and they will look at the back of my head, or the left and the right. Sorry. So top, bottom, left, right. And so it's really important that we do these views, because you can see things in a SPECT scan that allows you to, with the history, inform patients what's going on with their brain, and therefore what steps they can take to recover from the troubles that their brain is experiencing. And as I said, you're not stuck with the brain you have. You can make it better. If you experience cognitive decline, you can reverse it. There are loads of interventions you can take. And so I was super excited to look at my brain, and I look forward to sharing with you the results that I have with Dr. Lowe.
Well, I looked at your QEEG, and you did trigger the traumatic brain injury discriminant function.
What does that mean?
That means, we see evidence of head trauma in SPECT scans on almost everybody. But when you trigger the discriminant function, so this is Bob Thatcher's neuro guide. This is he was Roy John's graduate student, and so you had a discriminant score of negative 0.73, which kind of puts you right in the gray area there. But it gives you a probability index of 75% that you have about pretty close to a 4 severity index. So you're just right at the moderate area.
Okay.
And this was in 2019, right?
Yeah.
If you look at the amount of beta starts at about 13. So anytime we see a lot of beta, that goes along with head trauma. It gets better as you get to the higher frequencies of beta. But that was enough to trigger the discriminant function.
So my first assessment was revisiting my QEEG results that I had taken in 2019 to look at the trauma scores, the traumatic brain injury scores that I had, and what that inferred for me. Now, really first shocking findings that I had from Dr. Lowe was that I've been diagnosed with ADD. I wasn't hugely surprised that I have ADD, because I've always been called lastminute.com, but nevertheless, the indications are, based on all of my symptoms, based on my history, that I have ADD. But it's a particular type of ADD because of the findings from my brain scan that relate to my cerebellum, which is the back part, the processing part of my brain. More about that later.
Right.
So I smacked my head on the back right when I fell off the bike on a concrete pavement, and that the pain was there for about 2 to 3 years, maybe.
So this is your resting baseline study.
Okay.
And we're looking at the baseline activity of all the surfaces of your brain. And this is the best scan to assess for physical trauma and toxicity, okay?
Yeah.
The colors don't matter. They're just there to help depth perception and topography. We're going to be looking at these 4 views of your brain today.
Yeah.
This first view is looking from underneath.
Yeah.
So anytime I take the brain and flip it over and look at it from the bottom, it reverses left and right. So this is the left underside of your brain. These are the frontal lobes. The frontal lobes, the bottom of the frontal lobes, rest right on top of 2 little bony caves called the orbits that hold your eyeballs. So this is sometimes called the inferior orbital surface of the frontal lobes. This is the temporal lobe on the right side, temporal lobe on the left side. Down here's your cerebellum. That's the part of your brain that hangs down in the back. And here's your brainstem. And if I just keep coming straight out of the screen, that becomes your spinal cord.
Yeah.
Here we're looking from the right side, where this would be the front of the brain, the back of the brain. Down here's the cerebellum from the right side. And this is the right temporal lobe in here. Here we're looking at the left side, where this is the front of the brain, the back of the brain. Down here's the cerebellum from the left, and this is the left temporal lobe here. This view is looking straight down from the top. Now, in this view, left is left and right is right.
Yeah.
And this would be the front of the brain and the back of the brain. Now, your brain's divided into two halves or hemispheres. There's the left hemisphere and the right hemisphere. But running right down the middle is something called a longitudinal fissure. It's like a little valley between the two hemispheres. And this is the favorite place for cerebrospinal fluid to puddle or pool if you're out of alignment.
So the first thing that we did on my brain scan was really dive in to the surface images of my SPECT scan so I could understand whether my brain was in trouble from all of the traumas that I'd had, the brain traumas from falling off the bike when I was 21 and having car accidents and that sort of thing. And then also whether I was experiencing any toxicity. And thirdly, whether there was any impingement in my neck as a result of the head traumas that I had that was impinging my cerebral spinal fluid flow. And that's the flow of the fluid around from the back of my neck and then all the way up into my brain and back down again.
And it flows all the way down your spinal cord, all the way down to your tailbone, to your sacrum, and then back up into your brain. So as long as you're alive, there's this constant circulation of cerebrospinal fluid. If you do the math, the circulation cycle is 5 times an hour. That's pretty amazing.
That is amazing.
Yeah. What happens is when you're out of alignment, these toxic proteins slowly but surely build up and can cause all kinds of problems, including ultimately dementia. The 2 worst toxic proteins we know about are tau, T-A-U, very sticky protein. That's the one that forms the neurofibrillary tangles that we see in certain dementias. And then the amyloid protein is also the other nasty one because that gets converted to beta amyloid, which forms the beta amyloid plaques that we see in Alzheimer's and in other dementias. Both tau and amyloid protein can shut down neuronal transmission. So if I put some tau in the synaptic space, the tau binds to receptors on the downstream neuron and shuts down transmission. If I put amyloid, it binds to the upstream neuron and shuts down transmission.
Okay.
So this is what normal looks. That's what abnormal looks like. So this person has such a buildup of cerebrospinal fluid, it's compressing their brain and it's puddling and pooling alongside the longitudinal fissure. Such a buildup here, it's enlarged the ventricle. Well, here's the brainstem. Here's the cerebellum. You can see part of the cerebellum has herniated into the human magnum. This is called cerebellar tonsillar ectopia. This guy had seizures also. The more common symptoms tend to be headaches. Sometimes they're misdiagnosed as migraine headaches. Sometimes people will complain of like weird sensations inside their head. The kind of thing, if you tell the neurologist, he just thinks you're crazy. They have increased sensitivities to light or noise. Sometimes it can be smells or taste, but usually it's light or noise. They definitely
have increased sensitivity to light and smell.
They sometimes develop brain fog. Things like, why did I come into this room? Where did I leave my keys? Then they start having trouble focusing and concentrating. It can mimic attention deficit disorder. And then they start having problems with short-term memory. Some people will have other symptoms like word-finding difficulties. This gentleman had most of those symptoms plus seizures. The neurologist published a paper a few years ago. It was a longitudinal study of people who have concussions. And what they discovered is if you just have one concussion, it more than doubles your risk for dementia later on.
Wow.
So when Dr. Lowe presented to me that I had problems with pooling of my cerebral spinal fluid, it really, really shocked me. I didn't expect my brain to be as bad as it was in that context. But the good news is I can do something about it. And I have been fortunate enough to be able to get an assessment already to look at the alignment of my bones in the back of my neck, in particularly the atlas, and there will be interventions taken to help me realign it so that I can ensure that the cerebral spinal fluid flow is restored again. This is really, really, really important because this is so often missed by so many medical professionals. Like I said, I've had a child age 7 who's been missed by the medical professionals in the UK. And it's really key to understand here that MRIs do not pick this up if you are lying down, because you do not see information that's necessary when you are lying down to understand whether you have impingement of your cerebral spinal fluid flow, and it's so easily misdiagnosed. So it's really important that you get the right treatment from the right medical professional who understands what they're looking for, which thankfully Dr. Lowe does, which is why I went to see him, provide you with the appropriate advice to take the appropriate medical intervention to fix it. And the key thing here is, on my brain scan, the buildup of tau proteins and the buildup of beta amyloid plaque that happens as a result of the impingement of my cerebral spinal fluid flow is not because of anything else other than a structural deformity in my neck. I can take omega-3, that's really helpful. I can take supplements, but I have to fix the structural deformity in order to restore cerebral spinal fluid flow. And if I don't do that, I'm going to continue on this trajectory to cognitive decline. So we often perceive that cognitive decline, in terms of intervention, the typical interventions that we talk about is around nutritional interventions, and really, really important, and appropriate supplementation of omega-3 and B12. But unless you know what the root cause of your cognitive decline is through appropriate functional brain imaging, then you're not going to be taking the right steps in order to reverse it. And that's what's been amazing for me in getting the right scan to allow me to learn the steps that I can take to restore my cognitive function. And this is why I'm so passionate about helping children, young adults, carers, and parents learn about their brain health, learn what causes them memory issues, learn the 11 risk factors of memory loss, and the interventions that you can take early on in your life and later on in your life to reverse any cognitive decline.
You've got some decreases here in the frontal lobes.
Yeah.
So anytime we see decreases in the frontal lobes, we worry about things like anxiety, depression. And you did some screening scales for us. Yeah, it was like, I think you got a 2 on both of them. So it's minimal.
Mm-hmm.
I think for you, it's more the issues with attention and focus and concentration and executive functioning. Okay.
Mm-hmm.
People with ADD tend to have problems with organization and impulse control.
Mm-hmm.
So that probably is playing a role in some of those executive function issues.
So when Dr. Lowe noticed that I had lower activity in my SPECT scans, this is particularly around lower activity in the prefrontal cortex. So this is the executive function of my brain. This is the front part of your brain here. This is the newest part from an evolutionary perspective from when your brain developed. And it takes time to turn this part of your brain on. And this part of your brain is responsible for planning, for strategic thinking. It's responsible for making good decisions. It's often called the cop of your brain. And if you've damaged it because of traumatic brain injury, you experience ADD-like symptoms, and you can also get it as a result of overactivity of your deep limbic system, which prevents you from turning this prefrontal cortex on, because your deep limbic system, your reptilian part of your brain, is in charge. And you can also get it from low activity in your cerebellum, which is what Dr. Lowe discovered. My scans that were done to look inside my brain, where we look and see a tremendous amount of overactivity. And I'm going to talk about that next.
Cool. These are the activity scans. So this is the baseline.
Ring of fire, nearly.
No, it's not.
Oh no, it's not the ring of fire. It's pretty busy.
Well, yeah, but you're this was at rest.
Wow, deep limbic system, basal ganglia.
Here we're looking at the resting baseline activity of deeper regions and structures. It's the same 4 views we already talked about, but here the colors matter. The blue-black netting is normal background activity, except there's some cases you don't want to see that activity. The red is increased activity, and the white's the most increased activity of all. After doing this for over 30-something years, we've learned to limit these scans to only the top 15% of brain activity. And the reason is, if I said, I want to see 20 or 25%, your brain would just explode with activity. And all these structures would converge on one another, and it's really hard to make sense out of it. So we keep it at 15%. So we divide the 15% between the red and the white. And I guess because Dr. Amen doesn't like fractions, the white is the top 8% of activity. Now, the first place you want to look at on the baseline study is the cerebellum. The cerebellum only makes up about 24% of your brain, but it has more neurons packed into it than the rest of your brain combined. So it should be the most active part of your brain. And you've got activity, it's a little asymmetrical. There's more activity on this side than that side, but we see it in head trauma. And you also have a lot of blue-black in your cerebellum. Now, I know we said blue-black was normal background activity, but it's never normal to see it in the cerebellum. This tells me your cerebellum is playing a very big role in your ADD. So we'll wait and see what we see on the next scan, which is the concentration scan. This is your anterior cingulate cortex. You can see it here too. The cingulate cortex runs like a giant C. And anytime you see this kind of activity in the posterior cingulate cortex, that's a sign of superior intelligence and creativity. See all that there? The anterior cingulate cortex, this is the part of your brain that lets you hyperfocus, except sometimes you can hyperfocus on negative things. Somebody said something, or that didn't go the way I wanted it to, or I had a negative thought. So if you tend to obsess or ruminate over things, this is the part of your brain that's involved. It's also the part of your brain that makes me ask, are you a little bit of a perfectionist about certain things?
I can be, yeah.
That's part of that. And people who wait to the last minute, this is part of that too.
So the next part of my evaluation, we dove in to my subcortical scan. So this is looking at the activity deep inside my brain. So we're looking at the basal ganglia, we're looking at the deep limbic system, we're looking at the anterior cingulate gyrus, which is activity at the front part of my brain, which Dr. Lowe talks about, and the posterior cingulate gyrus, which is at the back. Now, for me, I'd had quite a few past emotional traumas, both as a child and also as an adult, more recently missing the death of my father. And I was really curious to understand how active was the deep parts of my brain. Did I need to do more work on it to calm it down, or had it calmed itself down from the work I'd done so far? And I was quite shocked to see the overactivity in some parts of my brain, in particular my deep limbic system, my basal ganglia, and my anterior cingulate gyrus, and also the underactivity in my brain, in particular the cerebellum, which is our processing part of my brain, of our brains, which sits at the back. And that is the area of our brain that should be really, really active. And unfortunately, in my brain, it isn't. And that causes me registration issues. And those registration issues result in me taking time to turn my brain on. So it's not because I'm not listening, it's just it takes me time to turn my brain on and have those thought processes coming into play. I'm not registering what people are saying. And that contributes to my attention deficit disorder diagnosis that Dr. Lowe has given me.
Another pattern, if I go from your thalamus to your basal ganglia, to your anterior cingulate cortex, back to your basal ganglia, back to your thalamus, that's the little diamond pattern.
The diamond, yeah.
And we see that in people who've had significant past emotional trauma. And this is the best way to treat emotional trauma, including post-traumatic stress disorder, is with havening.
So the other super interesting finding when we dove into the activity deep inside my brain is that I have what is called a diamond pattern in my brain, although it's not super strong. And this is evidence of past emotional trauma. One of the best treatment modalities for this is havening. And I used havening as an intervention to help me overcome trauma of witnessing my dad's death. And it was recommended as a modality for me to use by the Amen Clinics and to certify in. And I'm now a certified havening practitioner. So I'm really looking forward to reaching out to my colleagues to get some support in helping me with the reducing the overactivity in my brain that's a result of past emotional trauma. And I was quite surprised that I still have this. So I'm super looking forward to doing some more deep work on that and to downregulate the overactivity in my brain. And it's just fascinating to see how your brain is working. So what to do if you are worried about your brain health or that of others? Well, please do reach out to me. I can connect you with the relevant professionals and specialists. I do detailed brain health evaluations working in partnership with the Amen Clinics. I offer a wide variety of coaching programs for everything from young children all the way through to adults, and also memory rescue programs if you're worried about cognitive decline, as I was, so that you can learn about the most appropriate steps you can take and your family can take to calm down overactivity in your brain and to increase underactivity through appropriate interventions. I find this whole thing super fascinating. I think it's a huge shame that we don't have a functional brain imaging clinic here in the UK, which is what I'm on a mission to set up. And that is why I started the Wellbeing Warrior Academy, to help you, your family, your kids take back control of your brain and body health. Learn how to optimize it, get the best out of your engine of life so that you and your family can live a healthier and happier life. I hope you loved this episode. I've certainly loved the whole experience myself, learning about my brain, and I'm grateful I can share this with you. I hope you've got a lot of insight. Please post your comments below. Tell me what you learned. Tell me what you loved. Tell me what you didn't love. I look forward to connecting with you soon. And finally, do make sure you subscribe to my channel. It is super important for me that you subscribe and you share these episodes so that I can get more amazing guests on my show and share more fascinating insights into your brain, which is your engine of life. Do take care of it. I really hope you enjoyed that conversation. Thank you so much for listening. Please be sure to like and share this episode and leave a review on my website or on Apple Podcasts. If you're looking for opportunities to optimize your brain health or unchain your pain from a past trauma, make sure you visit my website www.ruthmaryallan.com and use the code podcast10 at checkout to get 10% off all programs. And always remember, you are not stuck with the brain you have. You have the power to make it better. You have the power to unchain your pain and optimize your brain power and performance so that you can win back energy and time doing what you love.